Well, as clinics and hospitals prepare their facilities to treat patients with COVID-19, healthcare workers who are at the forefront of the pandemic are gearing up for their own fight. Anthony Smith explains.
With new confirmed cases of COVID-19 in the Bahamas, the healthcare workers on the front line of this fast-spreading pandemic are taking charge, ensuring that while patients are safe and well cared for, nurses and physicians are protected too.
We don't want the worker to be working 10 and 12 hours. We don't want the workers to become overload. We want them to be alert, to know what's their surrounding, to prevent mistakes. So we're encouraging that, we have a shift, in place, and we've already spoke about this.
Nurses Union President Amancio Williams says it's a critical time for healthcare workers, as nurses and doctors are the persons most at risk for exposure and transmission. While at the press conference, Williams confirmed that 9 nurses are in self-imposed quarantine, doing so after possibly coming into contact with the virus at a healthcare facility. And when asked whether there was a concern that those nurses or healthcare workers could take pay deductions as a result, this is what she said.
We've already sat in closed doors with the minister, and the government assures us that they will look at and present our recommendations to cabinet, and we have good faith that while we do the job, the government do their job.
Another concern that presents itself, however, is the availability of essential tools. With disappearing stocks of masks and surgical gowns all over the world and no clear idea of what's to come, Bahamas Doctors Union President Millicent Bassett says healthcare workers are constantly in training, ensuring that they're prepared for whatever is to come.
We are constantly looking at that, relooking at it, trying to come up with new ways. You've seen other countries. They are always changing what they're doing to try and minimize the spread. So that's where we're at. We don't have everything we would like. I would like to have a N95 mask on everyone. It does not we don't have the resources for that. So we have to do the next thing that we are able to do.
Both union presidents say the next coming days will be critical, as data shows the virus has a tendency to peak at 45 days. However, the healthcare professionals note that it's ultimately up to the public to practice social distancing and hygiene rules to slow down spread and transmission. Anthony Smith, ZNS Network News.